In the world of trauma care, seconds can mean the difference between life and death. Today, we present a case involving a patient who suffered a gunshot wound to the abdomen, leading to hypovolemic shock. In this critical scenario, the nurses must move swiftly to assess, intervene, and prepare the patient for urgent surgery to give them the best chance at survival. This scene is taking place at Plantation Restaurant Club on January 12, 2024 at 5 p.m. where a few friends are out to drink at a day party. As you can see, they were having a great time until shots fired.
Oh my God, what happened?
I can't breathe.
Oh my God, and she's been shot. Gunshots went off. She needs some help.
The paramedics just arrives on the scene and assesses the patient and prepares for the transport.
She's shot. Lizzie, oh my God, Lizzie, are you okay? Lizzie! Lizzie, oh my God, Lizzie!
You're gonna have to stay right here. You're gonna have to stay right here
I have to call my friend.
Reporting live from Adult Traps News, Nassau, Bahamas. Apparently there was a day party at the plantation and it went wrong. Some people are saying it was a lover scene gone wrong. Some people saying there is a trap or gang scene. And some people are just running from hand the gunman and Shibul and they pop, pop, pop. So, but apparently some bystanders were shot and apparently in from a gunshot wound to the abdomen. Some got hit to the head and now we don't know what is happening. So please, Bahamas, let's follow to the scene. There's a bystander right there. Let's get them right now. Bystander, bystander, come, bystander, come. Calm down. Can you kindly, are you able to speak right now to me?
I'll try, yes.
What happened? Can you please tell Bahamas what happened tonight?
I was just paying attention to my phone, not minding anyone's business. All of a sudden, I just saw this young lady just collapse in front of me. Attending to her right on the scene, I'm seeing a big gunshot wound to her right abdomen. So I had no choice than to run to get some tissue, something, so that I could compress the blood so that she wouldn't bleed to death. This is so outrageous and so traumatic.
I know it's probably very traumatic to say, but thank you for your service. Nassau, Bahamas, you got it right there. Apparently, one lady has not succumbed to injuries and she's went to the PMH facility. So please, we'll keep you noted, okay? And reporting A.
The patient is brought into the emergency department with blood pooling rapidly.
Okay, emergency. We have Lizzie, the 28-year-old female weighing 160 pounds with a penetrating gunshot wound to the right abdomen. Vital signs are unstable. Temperature is 98.2 degrees. Pulse is 124 beats per minute. Respiration is 28 beats. BP is 80/50 and oxygen levels is at 89%. Approximately 800 mils of blood has been lost. No past medical history, no medications given, unaware of the type of firearm used.
Okay, got it. Bring it in. We'll take it over from here.
Okay.
The nurses now begins their assessment immediately. Their hands are moving with practiced efficiency. They check the patient's airway, ensuring it is clear, then assesses breathing and circulation. The patient's skin is cold and clammy, and her blood pressure is dangerously low, a clear sign of hypovolemic shock. Without wasting seconds, the nurse inserts 2 large bore IV catheters into the patient's arm. These lines will serve as lifelines, delivering much needed fluids and blood products to combat the rapid blood loss. The nurses orders normal saline to run wide open while waiting for blood products to arrive. Her clothes are then put in a biohazard bag and sent to CDU. The radio tech comes in using the ultrasound machine over the patient's abdomen, providing imaging results, along with the lab technician, who's now drawing up the labs that were ordered.
Okay, as you guys can see, there's internal bleeding, likely from a major vessel in the abdomen. This confirms significant blood loss.
Good evening, Dr. Green. We have the lab findings, which arterial blood gases is 7.32. The prothrombin time is 14.2, and the hemoglobin is to 5.6, which is dangerously low. The blood loss is very severe.
Okay, doctors, nurses already contacted OR. She's going to have an urgent exploratory laparotomy. So let's please let's get her prepared and stabilized so we can transfer straight to the OR, okay? Let's go.
The surgical nurse begins prepping the patient for surgery, applying temporary wound dressings and ensuring proper setup. They continue to monitor the patient's vital during this time, ensuring that the patient is stable as surgery is the only option. The porters arrive and gets the patient ready, securing monitoring equipment for safe transport to the operating theater.
Wait, I think we're getting ahead of ourselves. Let's take it all the way back to the beginning. Firstly, let's dive into how we can actually define hypovolemic shock.
Caused by anything that can lower the blood volume. So think hypo for low blood or low fluid volume. Typically from excess fluid volume loss through diarrhea, vomiting, or fluid shifts in burn patients. And as mentioned before, from bleeding or hemorrhaging from a trauma like a gunshot or knife injury, or even from surgery where we get too much blood loss and even GI bleed.
Let's move on to the stages of shock and how they manifest themselves.
Stage 1, compensated non-progressive. The body detects low blood flow and compensates by increasing heart rate, tachycardia, breathing rate, tachypnea, and vasoconstriction. Symptoms: confusion, irritability, lethargy, pale, cool skin, blue-tinged lips. Blood pressure remains normal due to compensatory mechanisms. Early intervention can slow progression. Stage 2, decompensated progressive. Compensatory mechanisms fail, leading to inadequate perfusion. Symptoms: deterioration in mental status, VPU on the AVPU scale, continued high heart and breathing rates, possible drop in blood pressure. Oxygen deprivation worsens. Stage 3, irreversible. Prolonged poor perfusion causes irreversible organ and tissue damage. Symptoms: severely low heart and respiratory rates, precipitously low blood pressure, organ failure. Death is the endpoint if untreated.
I know you didn't just fall asleep. And I was just about to get to the best part. You guessed it, how to manage the condition. First, let's talk about the medical management. The main goals of treatment here includes addressing the underlying cause of the fluid loss, in our case, applying pressure to the bleeding site or using a tourniquet in order to stop the bleeding. Next, you want to restore intravascular volume to reverse the sequence of events leading to inadequate tissue perfusion. For example, things like passive leg raising or proper positioning by lowering the head of your patient's bed to allow blood flow to be brought back to the brain and the core of the body. You also want to avoid high Fowler's position as it worsens the low blood pressure. Thirdly, you want to redistribute fluid volume. Common crystalloid solutions include lactated ringers and 0.9% sodium chloride. If the hypovolemic shock is due to blood loss, like in our case, it is recommended to administer 3 milliliters of crystalloid solution for each milliliter of estimated blood loss. You also want to administer blood products. Research shows improved outcomes for the patient when blood products are used over crystalloid resuscitation in hemorrhagic shock. After administering IV fluids, vasopressor medications like IV norepinephrine and dopamine are given in order to increase blood flow back to the heart, resulting in an increased maintenance of the patient's blood pressure. And let's switch over to the nursing management. Nursing management includes primary prevention of shock by assisting with fluid replacement before intravascular volume is depleted, and keeping a close eye on patients who are at risk of fluid deficits. It also entails safely administering blood products and prescribed fluids. You also need to closely monitor a patient's vital signs and observe for any complications in order to promptly report them to the physician. As a nurse, you are also responsible for documenting these prescribed treatments as well as their outcomes.
Now that you understand a little bit more about hypovolemic shock, the hardest part is facing the family. The nurse is met with the mother of the patient, her voice steady, heart heavy, and anxious.
1 second. What's your daughter's name?
Lizzie Malcolm.
Okay. Give me 1 minute. Sit back in the waiting room. I'll come and collect you, okay? I'll get a doctor to update you.
No, because I know you will stick too long to update patients.
No problem. Go sit in the waiting room. I'll get the doctor to be with you. 1 moment. Malcolm's family wants to be updated.
Who's Malcolm? I thought her name was Doe.
The gunshot wound. Malcolm.
Oh, okay.
In the waiting room.
Okay.
I need to be updated.
Okay.
Okay.
Malcolm? Malcolm?
Yeah. The doctor said that they George. Hi. Who's the mother of the family?
I am the mother.
Hi. So Miss Doe, she has experienced a gunshot wound to the lower abdomen. Okay. Now she is being stabilized. She is going to the OR right now. Okay. So please just calm down, relax. We're trying to get her as best as possible, right? Yeah. Any questions?
She didn't let me blood or anything.
Right now, she has been receiving some blood at this time. We'll update you, but please do contact some of your family members because we need more blood to be donated. Okay? All right.
Thank you.
In this scenario, the patient is experiencing the nursing diagnosis of fluid volume deficit due to severe blood loss from a gunshot wound to the abdomen. This is evident, though, that the patient's low blood pressure of 70/41 mmHg and a fast heart rate of 120 beats per minute, both signs that the body is struggling to compensate for the loss of blood. Our focus as nurses is such a case to act quickly by replacing fluids, stopping the bleeding, and closely monitoring the patient. This ensures that the body gets the blood flow it needs to keep vital organs functioning. This case shows how nursing care directly impacts survival, emphasizing the importance of assessing and intervening immediately.